Hey, welcome to our explainer. Today, we're basically going to be medical detectives. We're solving a mystery where the main culprit is just a tiny little spot on a lung scan. And the big question is it a killer or is it completely harmless? Well, the answer to that question, it really did change everything. Low-dose CT scans have been an absolute game changer. They let doctors spot lung cancer way, way earlier than ever before. But here's the twist. This amazing technology, it accidentally created a whole new problem. It started seeing too much. And believe me, the stakes here are incredibly high. Research from the International Early Lung Cancer Action Program showed that when you find lung cancers early with CT screening, the cure rate can be as high as 80%. I mean, that is a massive leap forward in the fight against what is still the world's deadliest cancer. So here's the mystery. For every single life-threatening tumor these scans find, they also pick up countless other tiny spots or nodules. And it turns out the vast majority of them are totally harmless. So the critical question became, how on earth do you tell the dangerous ones from the innocent ones without making patients go through months of anxiety and maybe even risky procedures? And that brings us right to the heart of the problem, a real dilemma that was basically created by our own success with technology. So, as these CT scans got better and better, the number of tiny nodules they were finding just skyrocketed. And for both doctors and their patients, every single spot was a huge question mark. It created this massive challenge. What they needed was a reliable set of clues, kind of like a criminal profile, to separate the harmless bystanders from the real culprits. All right, so the investigation kicks off in a very specific place in the lung, looking at a very specific type of nodule. And this is where the first real clues started to pop up. Researchers started by zeroing in on these spots called periphyseal nodules, or PFNs for short. Now just think of your lungs for a second. They're divided into different sections by these thin walls called fissures. Well, these PFNs were just tiny, solid spots found right on or next to those dividing walls. They were super common, and they became suspect number one. And this was the first huge piece of evidence. A really influential early study tracked 234 of these specific nodules for over 7.5 years. And the result? It was stunning. Not a single one of them, not one, turned into cancer. This was the first major piece of the puzzle, suggesting that where a nodule is and what it looks like could be a really reliable clue to what it is. Okay, so with this massive clue in hand, the scientific detectives, they knew they were onto something big. It was time to see if this pattern was true in other parts of the lungs too. And the process they followed was just, well, it was super logical. First, they proved that the nodules on the lungs' internal walls, those fissures, were safe. So they asked the next obvious question. Okay, what about the nodules on the outer lining of the lung? The part near the ribs, or the part near the heart. They were building, step by step, a complete map of these harmless spots. And this is where it gets really cool. They started profiling these nodules, almost like a detective profiling suspects. They weren't just looking at the location anymore. They were looking at the shape. And they found that nodules with these specific smooth shapes, like triangular or semicircular or lentiform, which just means lens-shaped, were almost always benign. It was the irregular, spiky shapes that were a whole different story. So after years of collecting all this evidence from all over the lungs, the researchers finally had what they needed. They could create a definitive profile, a checklist of features for a nodule that could be confidently dismissed as harmless. And here it is. This is the profile of a benign nodule. If a spot is solid, if it's smaller than 10 millimeters, has smooth edges, is attached to any of those lung linings, and has one of these classic shapes, lentiform, oval, or triangular, the evidence is just overwhelming that it's not a threat. And this chart here, it just brilliantly pulls everything together. You can see on the left, you've got the different locations attached to the fissures, or the linings near the ribs or the heart. And on the right, you see that if the nodule has those features we just talked about, solid, small, smooth, regular shape, the recommendation is exactly the same for all of them, just a routine annual follow-up. Essentially, case closed. So what does this actually mean in the real world? Well, it's a huge deal. Before this research was all pulled together in 2022, the official guidelines, called Lung-RADS, would have called these nodules probably benign or maybe even suspicious. That meant you had to come back for another scan in just 3 to 6 months. Now, they're officially reclassified as benign, which just means you come back for your standard 12-month annual checkup. That is a massive shift. But, of course, solving the case of the benign nodule is only half the battle, right? All of this research also helped us get a much sharper focus on what makes a nodule truly dangerous. So let's put them side by side. The benign nodules, they're smooth and stable. The malignant ones are pretty much the opposite. They often have these irregular, spiky, or what they call spiculated shapes. Think of something that looks kind of jagged or like a star. They also tend to grow over time, and they can have other red flags, like causing the lining of the lung around them to get thick. And get this, one of the most powerful warning signs has a pretty unforgettable name. It's called the jellyfish sign. And it's exactly what it sounds like, a nodule that has multiple little strands reaching out to the lung lining, just like tentacles. When a radiologist sees this, it's a major red flag that they might be looking at a more aggressive tumor. And it's not just the jellyfish sign. Doctors are also looking for other warnings. Any thickening of that lung lining right around the nodule, or if the nodule has a really broad base where it touches the lining, or multiple little connections or tags, these are all features that point away from that benign profile and towards something that needs a much closer look right away. So let's bring it all home. Why does solving this mystery matter so much? It means that for thousands and thousands of people going for lung cancer screening, a finding that used to cause months of worry and repeat scans can now be confidently called harmless. It means less anxiety, fewer tests you don't need, and a smarter, more efficient screening system that can focus on finding the real threats. You know, this whole story is just a perfect example of how medicine moves forward. You get a new technology, it reveals a new layer of complexity, which creates a new mystery. And that mystery is what drives the new research that leads to a smarter, better way of caring for people. It really makes you wonder, as our ability to see inside the human body gets even more powerful, what new puzzles are we going to have to solve next?